After finishing dentistry, every dentist can easily diagnose gum disease and decay. But when it comes to the bite, it was all about experience as to how much of force you felt with your hand when the patient was biting that articulating paper. The most astute of dentists would be able to recognize patterns of whether the patient is biting more heavily on one side, or if they're grinding their teeth, if they have any form of premature contacts, and if assuming the patient was unable to glide their teeth after a new crown had been placed, how to adjust it and minimize the damage to the crown. Now with T-Scan, you take away all the guessing. You have precise diagnostic data that will tell you exactly where on which tooth, on which cusp there's an excess force. With which case, you still use the articulating paper, but now you know the magnitude of that force being exerted and you can actually adjust it. And once it's adjusted, redo the T-Scan again to see whether there's any form of improvement or so. The T-Scan consists of a sensor which is connected via USB to your nearby laptop or a computer. The clinician would then take the sensor and place it in the patient's mouth. The patient bite onto the sensor and hold it there. We first calibrate the sensor by adjusting how much of the wave or the amplitude of the bite force curve we want to see. Then we can proceed to start making our assessment and diagnosis. So the great news is that it's actually very easy to use. The sensor itself, it's very simple to actually load into a handle, and it comes in two sizes. The sensors come in a small and a large. The program which will be used to record the scan data, it's actually very simple to use and very intuitive. Literally just plug it in, type a patient's name, choose how many teeth the patient and select which teeth the patient has or doesn't have. Take a bite, do a recording, record this up to 25 times with a single sensor. It's as simple as ABC. We can detect decay very easily using X-rays, but an X-ray doesn't tell us how well or how badly a patient is biting. And if we are here to make a diagnosis, we have to do it well by not just using colored pieces of paper to tell us where and how the patients are biting. We need to know the force distribution. So this is the way I fundamentally changed the way I approach my patients. For the patients I do especially complex work on, whether it's full mouth implants, whether it's a single implant, these patients need to know whether they're going to be comfortable with their bite thereafter. Because you would be able to actually analyze where the patients are biting before they've had treatment, after they've had treatment, to ensure you can try and mimic or at least reproduce what they've had before with a new bite that you have given them.